I'm Jim Towey, one of the commissioners on the Commission to Build a Healthier America. America, while it prides itself as a great superpower, has a long way to go to develop a healthier citizenry. Unfortunately, for many Americans that have the wrong zip code, they're almost set up to fail on the health front unless we change things. I think the field trip in Philadelphia out to a grocery store that against all odds existed, where you could get fresh vegetables, where here you were in a neighborhood that was fairly run down, and you had this beautiful grocery store that actually provided healthy food for people, and then to find out statistically how rare a facility like that is and how it really required a lot of leadership in the Philadelphia community with a lot of people coming together to make sure this happened. That really surprised me because I think I took for granted from the neighborhoods that I grew up in, there was always access to produce and healthy food. I may not have always chosen it, but I could always get it if I wanted it. And then to see that for many parents, if they don't have the transportation, if they don't have the right neighborhood, they're cut out from healthy choices. I remember walking around that store and seeing the pride of the people and seeing a minority community that was being served and wondering why can't we do this in more places in America. I think that's one of the nice things about the Commission recommendations is that it provides for each community something they can do now, not wait for government, not wait for a new program, not have to see some huge spending increase to make a difference. I remember people participating from all over the country and sharing some of their ideas. You get a feeling that there are more people out there working on this than you realize. So that was encouraging to me, but I think the Commission's made a dent in the debate. There's more work to be done. Now the question is what comes next, and what will America do, and what will communities do with these recommendations, and that requires effort by a lot of people, including myself. I wasn't aware of how extensive this obesity issue was. When you look at what we did on smoking, for example, I mean, when I grew up, people were smoking on airplanes, they were smoking in their offices, they were blowing smoke in your face, and nowadays that's stopped. And so I'm not that old, so you get the feeling like if people come together and work on something, you can see a difference. And if it happened on smoking, it can happen on food, it can happen in other areas. We often find ourselves in public policy trying to fight the problem instead of going to the source of where it began. And if we looked at these prevention initiatives, which the Commission has highlighted, you would find health costs dropping quickly. And so that, to me, I'm hoping that as the healthcare debate continues to occupy center stage, people start to realize, well, why don't we go to the root of the problem? Why are people so sick in the first place? I think it was ambitious for the Commission in the midst of a healthcare reform debate to place in the front and center spot this issue about improving health and a healthier America, and I'm glad they did.